Hi, all. Welcome to Patient Teacher. We educate, we empower our patients. Today's topic is bone marrow transplantation in children, what parents need to know.
Thanks, patient teacher, for this opportunity. This is very important topic to discuss. In my opinion, all the parents should know in detail about bone marrow transplantation before they go for BMT in their children.
Doctor, is bone marrow transplantation and stem cell transplantation the same?
Yes, as you asked, they are same. Some people say bone marrow transplantation and some people say stem cell transplantation. Actually, they are same. Old terminology is bone marrow transplantation or BMT. However, in my opinion, better terminology is stem cell transplantation because what is being transplanted is stem cell.
Okay. Doctor, what are blood stem cells?
Blood stem cell is mother of all blood cells. Blood cells are red blood cells, white blood cells, and platelets. Blood stem cell located in bone marrow. In bone marrow, blood stem cell divide and develop into different types of blood cells. That is why if any disease affecting the blood stem cell or blood cells, we can do bone marrow transplantation.
Okay. Doctor, is bone marrow transplantation something like a major surgery? For example, is it like kidney transplantation?
Well, that is very important question. That is one of the misunderstanding among the uh, many parents.
Okay.
Actually, bone marrow transplantation doesn't involve major surgery like kidney transplantation. It is like a simple blood transfusion. What is happening is we collect blood stem cell either from the bone marrow or from peripheral blood, then we give to the patient as a simple blood transfusion.
Okay. Doctor, what are the different types of bone marrow transplantation?
Bone marrow transplantation can be allogenic bone marrow transplantation or autologous bone marrow transplantation. What is happening in allogenic bone marrow transplantation is we are taking blood stem cell from the donor. However, what is happening in the autologous bone marrow transplantation is we are using stem cell from the same patient.
Doctor, please elaborate on autologous bone marrow transplantation.
Actually, what is happening in autologous stem cell transplantation is stem cells are from the patient themselves. The goal of using patient's own healthy stem cell are to overcome the effect of high dose chemotherapy that are used while treating certain types of cancers in children. That is why this is also called high dose chemotherapy with autologous stem cell rescue. In this procedure, what is happening, stem cells are collected from the patient when the bone marrow of the patient is healthy. This is called stem cell collection or stem cell harvest. This collected stem cell are stored in a special way for weeks or months as live without dying. This is called cryopreservation. At some stage of the treatment, when the child is given high dose of chemotherapy, the bone marrow, that is stem cell of the patient, are destroyed by high dose chemotherapy. In this occasion, what we do is we take the cryopreserved patient's own stem cell and transfuse to the patient so that this stem cell will go to the bone marrow of the patient. They divide and they develop into blood cells such as red blood cells, white blood cells, and platelets. In children, autologous transplantation is used as a treatment method when some of the cancer in children are very difficult to treat with usual chemotherapy, such as high risk neuroblastoma. Sometimes autologous bone marrow transplantation also used when the cancer come back after usual chemotherapy, like lymphoma or brain tumors.
Okay. And what about allogenic bone marrow transplantation, doctor?
What is happening in allogenic bone marrow transplantation? We use donor, another person, as a stem cell source. So we collect stem cell from the donor, then we transfuse, we give to patient as a blood transfusion. One of the aim in allogenic transplantation is replace unhealthy, faulty, or malfunctioning stem cell of the patient with the normal stem cell from the donor. In this procedure, stem cells are collected from the donor. This is called stem cell collection or stem cell harvesting. It can be from the bone marrow of the donor, then it is called bone marrow stem cell harvesting. It can be from blood of the donor, then it is called peripheral blood stem cell harvest. These collected stem cells are usually given to patient within 48 hours as a fresh, then it is called fresh transplant. This collected stem cell can also stored in a special way called cryopreservation if they are not used within 48 hours of collection. Stem cell also can be collected from the cord blood when any baby is born and stored in cord blood stem cell bank in a special way for the future use. This type of stem cell transplant using cryopreserved cord blood stem cell called cord blood stem cell transplantation.
Okay. Doctor, is it risky for children who undergo BMT?
BMT in children rarely associated with complications.
Okay.
Sometimes it can be very serious, even it can lead to death. However, in most of the situation, it is very safe procedure, and by doing bone marrow transplantation, the success rate is very high in children.
Doctor, what is HLA matching in BMT?
HLA matching means HLA is a special identification marker on our body tissue or cells. This pass through the family. Therefore, there is a 30 to 35% chance that one can get their HLA type matched with brother or sister. If you do allogenic BMT with stem cell from HLA matched donor, the success rate is very high and the complication after BMT is very low. Therefore, HLA typing of patient and potential donors in the family are very important step to try to get the best HLA matched donor. In autologous BMT does not need HLA typing and matching because we are using the stem cell from the patient itself.
Who can be the donor in allogenic stem cell transplantation, doctor?
In allogenic bone marrow transplantation, donor can be related or unrelated. If they are related, that means either brother, sister, or parents. Donor also can be HLA fully matched or not fully matched. Depends on the HLA matching and the relationship between the patient and the donor. There are different terminologies we use in bone marrow transplant situation. They are matched related donor or matched sibling donor or matched unrelated donor or mismatch related donor. The result of BMT is better if the donor is related as compared to unrelated donor. Result of BMT is also better if the patient HLA is fully matched compared to unmatched HLA. So the result of BMT is at the best when the donor HLA is matched and donor is related.
Doctor, what is matched unrelated donor in BMT?
Matched unrelated donor means when we don't get matched donor from related, that means brother, sister, or parents, we can also search HLA matching through International Stem Cell Registry. If we can get matched donor from international registry and we can get the stem cell from them, and if you do the transplantation, this is called matched unrelated donor transplantation.
Doctor, what is haploidentical stem cell transplant?
Haploidentical bone marrow transplant means when there is no matched related donor, when there is no matched unrelated donor, how we can do bone marrow transplantation? In the past, it was very difficult. However, recently, we have learned through research that we can do bone marrow transplantation with the donor with 50% match. That means haploidentical donor. For a child, who is haploidentical donor? For a child, all the parents are either mother or father are haploidentical donor. So that means we can do haploidentical bone marrow transplantation in every child if his or her parents are healthy and fit to donate. Recent evidence show that the result of BMT or stem cell transplantation by using matched unrelated donor or haploidentical relatives, that is, parents, are comparable based on the evidence.
Doctor, what is the most important thing parents need to know before doing a BMT?
The most important first step is HLA typing of the patient and their brothers and sisters to see they are HLA matched or not.
Okay, and is there a risk in being a donor for a BMT?
Very important question.
Okay.
In general, most of the donors or most of the potential donors, when they think about stem cell donation, they have these questions.
Okay.
And some of them believe they can have problem in future.
Once they donate.
Actually, it is not true at all.
Oh, okay.
There is no associated problems, whether it's short term or in the long term. And there is several publications published about this.
Okay.
In fact, what stem cell donor is doing is they are saving another human life.
Okay.
So it is a great and noble job what they are doing.
Now, what are the different steps in BMT, doctor?
Yeah, in BMT, I can briefly give you what are the different steps. However, I will explain in future video in detail about each step.
Definitely.
What is the first step? First is we need to know that your child has a serious disease or child has a certain condition which really indicated, that means by doing the transplantation it can be treated and there is no other treatment method we can use to treat the condition. So basically we need to confirm that your
Diagnosis.
child has a important clearly indicated diagnosis to do the bone marrow transplantation. The next step is we need to find out the donor.
Yes.
How we can do HLA typing of the family members, including brothers and sisters and parents. Once you get potential donors by doing the HLA, if any of them are fully matched. If not, you can also do search for HLA matched donor through international registry. If we are not getting matched unrelated donor through international registry, what we can do in children is we can take stem cells from either mother or father. That is called haploidentical bone marrow transplantation. Once we decided the donor and once we decided the patient indication, the next step is we will do some investigation to make sure that your child patient is fit to receive stem cell from the donor. Same time, we will also do some investigation with the donor so that we can make sure that the donor is fit to donate stem cell. At the same time, we also do some investigation to make sure that donor is safe for the patient to receive stem cell from the donor. Once we have cleared all this investigation and both of them are fit and safe, then we admit the patient to a special ward. Then we give special medication. This is called conditioning chemotherapy. Sometimes we also give radiation. Why we are doing this? This chemotherapy and radiation make bone marrow of the patient ready to receive stem cell from the donor. Same time, we will also prepare donor to donate stem cell. Maybe we admit few days before and we give special injection. It's called GCSF to increase the production of stem cell, or sometimes we don't use this. On the day of transplantation, even many days before of transplantation, we decide whether we are using stem cell from the blood or we are using stem cell from the bone marrow. Depends on the situation. We collect stem cell either from the bone marrow or the blood of the donor, and we collect as a blood. After collection, we transfuse this stem cell to the patient. Once we transfuse the stem cell, we monitor patients for next 2 to 3 weeks in a special ward. During this time, patient can develop several complications. We monitor is there any development of complication. At the same time, we also regularly check blood cells of the patient so that we can see that is there any new blood cells are coming up. That is the first sign of success. When the neutrophil, that means one of the white blood cells of the patient is coming up nicely, even more than 500 for 3 days, we can say that neutrophil is engrafted. That is the first sign of success. Of course, later on, we do several tests, namely chimerism, to make sure that donor stem cell is growing in the bone marrow of the patient. Once we confirm the success of bone marrow transplantation and there is no complication, we discharge the patient to home. However, we regularly see the patient in our outpatient clinic. Initially, up to 100 days, we see them very frequently, maybe twice per week or once per week. Then we slowly reduce the frequency of outpatient consultation if there is no complications. So this will go up to 1 year. After that, we will confirm again the success of bone marrow transplant by doing some blood tests, including chimerism. Then we revaccinate children with all the usual vaccination. That is the time we really say that bone marrow transplantation is very successful. They can mix with other children, they can go to school, they can play with other kids, and so on.
Doctor, now how long does it take to prepare a child before BMT?
Yes, usually it will take 2 to 4 weeks
Okay.
to prepare both patient as well as donor.
Okay. And after the procedure, how long do they have to stay back approximately?
Once we decided to do the bone marrow transplantation, we admit the patient in a special BMT ward.
Okay.
Usually 30 to 40 days we admit in a special ward where patient will be isolated
Okay.
alone. However, parents can stay with them. This is to avoid complication. This is to avoid infection.
How long should the patient follow up with the doctor after discharge?
Usually it is up to 1 year.
Okay.
However, the first 100 days is very important. They need to go and meet doctor in the outpatient department regularly, maybe once in a week, maybe once in 2 weeks, and doctor will do some blood test. Doctor will also assess is there any complication because of the bone marrow transplantation.
What are the complications that are associated with BMT?
As I mentioned before, BMT in children has very high success rate.
Yes.
The success rate is keep going up with more scientific advancement. However, the BMT as a procedure is not without complication. Rarely, children can have very serious complications requiring intensive care support. Sometimes we may need to put on ventilator to make sure that patient get better. The most important complication is infection because when we give chemotherapy, the immunity will come down. So they are prone to have several infection, mainly bacterial infection, viral infection, fungal infection. So these infection can cause death in children. So during that admission, doctor will monitor for any evidence of infection, then child will be treated. Other complications are when we give chemotherapy and radiation to prepare patient to receive stem cell, this chemotherapy can cause liver dysfunction, kidney dysfunction, or brain dysfunction. So there are several complications, side effects can happen because of the chemotherapy. However, doctors regularly monitor, assess, and depends on the complication they manage. The other well-known complication during transplant, especially Allogenic bone marrow transplantation, is graft versus host disease. It is also called GVHD. What does that mean? Is when the stem cell is infused, it will also contain other cells from the donor. These cells, when they enter into the patient blood, they also multiply. This cell identify patient as a foreign and it cause a lot of reaction or fight between the cells coming from the donor and patient's tissue and cells. The main area which is affected are skin, food pipe, and liver. So after the BMT, children can get skin GVHD, food pipe GVHD, or liver GVHD or liver GVHD. There are very good treatment available to treat most of the situation. We can treat children who develop GVHD.
Doctor, what is the result of BMT in children?
Yes, I think, over the years, because of the scientific advancement and technological advancement, the result, the outcome of bone marrow transplantation in children has significantly improved last few decades.
Okay.
So currently, of course, this is depends on disease to disease, centers to centers, hospital to hospital. But in general, result is very good, very high in children. Roughly, we can say the range between 70 to 90, 95%.
And what are the conditions where BMT is the treatment recommended or indicated?
Yes, BMT can be used as a treatment method in several conditions in children. Some of them are cancers, some of them are non-cancers. Cancerous conditions include leukemia, lymphoma, neuroblastoma, sometimes even brain tumor when the normal treatment is not effective or the brain tumor is coming back. We can also do autologous bone marrow transplantation. Among the non-cancerous conditions, which include thalassemia major,
Okay.
sickle cell disease, aplastic anemia, primary immunodeficiency disease. Thanks, patient teacher, for this opportunity. It is very important topic you have selected today. Thank you very much for listening. If anything you need to know further, please contact us.
Thank you so much for watching. Do like, share, and subscribe.